Hi, Jeremy.
Hi.
I'm Dr. B. I'm going to be doing a cranial nerve exam on you today, as well as checking some other stuff with your head, neck, and shoulders. Before we start, I'm just going to take some health history since the last time we've seen you here at the office. Have you had any issues with your head? This might include headaches, dizziness, trouble sleeping, trouble thinking, anything like that?
No, not really. Maybe just the occasional headache.
Okay. And no pain or tenderness to the touch of your head?
No.
Okay, we'll check that out. Moving down to your eyes, I see you're wearing glasses. Is this your usual prescription?
It is, yeah.
Okay, and how is that doing for you?
Fine, I think.
Okay, so no trouble seeing, your vision seems clear, you don't have any floaters in your eyes or anything like that? All right, and what about your sense of smell? Have you had any trouble smelling for the last 6 months?
No.
Okay, and can you breathe through one nose and the other? Any nosebleeds, anything like that?
No.
Great. And what about your mouth? Any issues with sores or issues with your teeth, gums, pain, bleeding?
No.
Perfect. And how often are you visiting the dentist?
Try to go twice a year.
Okay, perfect. Great. And what about your neck and shoulders? Any issues swallowing, with swelling in your neck, anything like that?
No.
Great, so everything seems pretty healthy, but we'll go ahead and do the check just to be sure. This also helps our office just keep consistent records with you, okay? So first thing I'm going to do is check a couple of your vital signs. Do you have a preference of blood pressure arm?
No.
Okay. Go ahead and just give me that one. And relax for me. Do you generally have any issues with your blood pressure?
Sometimes it's high at the doctor's office.
Okay, could be a little nerves or anxiety as well. So we'll go ahead and check that out. So just breathe normally and relax. Okay. A little high, but not abnormally high. I'm not worried. You said you get a little nervous at the doctor or something?
Yeah.
Yeah. Can be a little bit stressful coming here, but hopefully you're all healthy. I'm just going to take some pulses and watch for your respiration. So go ahead, relax, just breathe normally. And I'm just watching your chest rise and fall, counting how many respirations you're having in about a 1 minute period. While I'm doing that, I'm just feeling your pulse, make sure it's even and steady, and counting how many beats per minute. All right, perfect. Your heart rate's normal, so that makes me even less worried about slightly raised blood pressure, but your respirations seem consistent, even, not labored. Did you have any trouble breathing just then?
No.
Okay. Just make a note of that. And put in the blood pressure as well. So we're going to start the cranial nerve exam now. I'm going to start by just feeling your head. Would you mind removing your glasses for me? Is that okay? Set that to the side. Okay, and close your eyes for me and just tell me if there's any pain or tenderness right here.
No pain.
No pain? Down here, anything?
No.
No. Okay. I'm just checking a couple spots here on the head. And sometimes have some hidden things. The scalp looks clear, the hair looks clean. No dryness or flaking. It's very good for winter. Okay, and hair is healthy, distributed, thick, and all one color. Okay. Looking at your eyebrows as well. They look symmetrical on both sides, even hair distribution. No scarring. And the eyelashes as well, nice and healthy and full. Do you take any vitamins?
Just the occasional fish oil, vitamin D.
Okay, perfect. Yeah, so that's probably why you're seeing such healthy hair growth, so I'd definitely continue to do that. And take a listen to your temples. And before I touch your eyes and your mouth, I'm just going to sanitize my hands and put on some gloves. Have you look straight ahead and just look up for me? And can you look down for me as well? Very good. Any pain when I touch on the top lightly here?
No.
And anything in the tear glands?
No.
Okay. While I'm here, I'll just check your sinuses. Just let me know if that bothers you at all. Feels okay?
Mm-hmm.
Great. Again, stare straight ahead. I'm just going to be checking for some light reflexes. Pupils are reactive. Good. I want you to look at the tip of my pen and follow it everywhere it goes. Any double vision here?
No.
Okay. Watch the pen as it comes into you. Very good. Good constriction. No issues there. I'm just going to take a look at the red reflex in the back of your eye. So stare straight ahead over my shoulder. I'm going to get very close, okay? Good. And come around to the other side. Same thing. Okay, excellent. Got a chart right here for you. I'm going to hold it right about here. Can you read this line for me?
DHJBS.
Okay, wonderful. Can you cover one of those eyes for me, please? And read this line backwards.
SBJHD.
And cover the other eye. And this line forwards.
DHJBS.
Excellent. Just checking the size of your pupils. Pupils are about a 4. Perfect. Got a few colored vials here. Just going to hold them up in front of you. Tell me what color that is.
Blue.
Okay. And this one?
Orange.
All right.
Pink.
Mm-hmm.
Yellow.
All right. And a little bit of a math question here, or rather a logic question here. If I put these two colors together, yellow and blue, what color would I get?
Green.
Would you prefer to wear your glasses, or are you okay for now that we're done with your eyes?
I'm fine.
Okay, great. Next thing I'm going to do is check your nose and your sense of smell. So first thing, can you breathe in for me? Okay, and on this side? Okay, a little bit of occlusion on that right nostril. Do you have issues with snoring or stuffy noses ever?
Yeah.
A little bit.
Mhm.
Is it depending on how you sleep, or is it just day to day, the stuffiness of your nose?
Just kind of day to day.
Okay. If you ever want to do a more in-depth exam on that, we can have you come in and we'll take a deeper look at that nose. But let me just look inside it, see what I see. So tip your head back for me, close your eyes. Looks like you got some slight deviation in that septum and a little bit of swelling and redness. So you might have to go get a specialist to look through that and decide if you want to go through with trying to undeviate that septum. But if you can breathe and you're okay on a day-to-day, it's not an emergency. I'm going to give you a couple things to smell. I want you to just close your eyes. I'm going to just waft it underneath your nose. Can you tell me what that smells like?
It smells like peppermint.
Very good. This next one's a little bit more challenging.
Lemon, I think.
Very good. All right, so yeah, I'm not too worried about the severity of that occlusion in that nose. You're smelling just fine. You can breathe okay. Just more if it bothers you, okay?
Mm-hmm.
All right. Take a quick look into your mouth now. You open up and say, ah. Good, everything's moving. I'm just going to feel around a little bit. Can you push your tongue into my hand here? Good, and good strength. And this side. Okay, I'm just going to take a look at those gums. So I'll open up simply. You said you go to the dentist twice a year.
Try to.
Gotcha. Okay. Any issues with your jaw? Can you open and close for me? A little bit of clicking there. Is that painful?
No.
No. Okay. Again, one of those things that might start to feel worse over time. Just a little bit of crepitus in that TMJ, but if you can open and close just fine, and it's no pain. Again, it's more of a when you feel like it thing.
Mm-hmm.
All right, I'm going to take a look into your ears. Oops. Okay, I'm going to give you a couple things to taste. So I want you to just open your mouth. I'm just going to gently put something in there. And can you tell me what that tastes like?
Salt.
Yep, very good. Again, another one right here. Open your mouth just a little for me. What does that taste like?
Garlic, I think.
Yep, perfect, very good. All right, now I'm going to check your ears. Just doing a general inspection first. Any pain or tenderness when I press on that?
No.
What about here?
No.
On this side, any pain?
No.
And here?
No.
Okay. Just taking a look on the inside. Nice and clear. Do some hearing tests. So I want you to tell me which side you hear the noise on, okay?
Right. Left. Left. Right. Center. Center. Right.
Good. Got this tuning fork here. I'm going to hit it and put it on the top of your head. Tell me if you hear it left, right, or both.
Both.
Good. It's the same thing. I'm going to hit it. I'm going to put it right behind your ear. Tell me when it goes away.
It's gone.
Can you still hear it here?
Mm-hmm.
Excellent. Same thing on this side. Tell me when it stops.
Stop.
And how about now?
Mm-hmm.
Great. All right, so everything looks intact with your hearing. I'm going to do a little bit of strength testing and some neurological testing now. First thing I want to do is just some basic measurements around the skull. Good. Okay. And I'm going to have you tip your head back as far as it can go. Okay, any pain with that?
No.
And tip your head forward as far as it can go. Very good. No issues there, right?
No.
All right, you can look up now and just turn your head all the way you can to the side and resist me. Okay, and this side and resist. Very good. Can you push forward against my hand and back against my hand? Beautiful. You shrug your shoulders for me. Okay. I'm going to just be feeling your lymph nodes now, checking for any swelling. Maybe one here on that side, that left side. You shrug a little bit for me. Okay. I'm also going to come around, just have you swallow. Can you swallow for me? Excellent. I'm going to do some sensation testing on you. So I have a real soft piece of fabric here. I'm just going to touch it on your face, and I just want you to tell me yes when you feel it.
Yes. Yes.
And did that feel the same on both sides?
Mm-hmm. Yes. Yes.
And that's the same?
Mm-hmm. Yes. Yes.
Very good. Everything felt symmetrical.
Mm-hmm.
All right. Can you go ahead and lift your eyebrows for me? Good. And open your eyes nice and wide. And close them nice and tight. And don't let me open them. Okay. Can you open your jaw for me? And don't let me close it. Okay. And can you puff out your cheeks? And don't let me push on them. Very good. Okay, everything looks nice and symmetrical. Smile for me. Okay, very good. Yes, nice and even and symmetrical. No issues there. Test a couple of reflexes while I'm here. So just let your jaw hang. Okay. And does this feel a little sharp?
Mm-hmm.
This sharp here?
Mm-hmm.
Tell me sharp or this is dull, okay? Close your eyes. Tell me sharp or dull.
Sharp. Dull. Sharp. Sharp. Dull.
Okay, very good. Can you give me your hand, please? I want you to look straight ahead. Okay, the other side. I'm going to draw a number in your hand. Tell me what number I'm drawing.
3.
Okay, the other side. This one's going to be a letter.
A.
Okay, great. I'm going to have you do some basic math for me. Can you subtract 8 from 100?
92.
Now subtract 7 from that.
85.
Great. So it seems like your mental acuity is intact. You know where you are today, correct?
Mhm.
Where are you at?
Dr. B's.
Perfect. All right, Jeremy, let me just check my notes, okay? All right, Jeremy, that's everything I have for my notes today. I've just logged everything we've talked about, made a note of that septum there, a little bit of issues with the breathing, as well as that swelling on the left side of your lymph nodes there. So we'll keep an eye on that. Any issues, just come back in. We'll do more of an advanced assessment. But otherwise, do you have any questions for me today?
No, I don't think so.
All right, well, wonderful. Don't forget your glasses and have a great day.
Thank you.